Thank you very much, Karen, and welcome to all who are joining us from the Americas, Europe, Middle East, Africa, Asia, and the Pacific. Today, we discuss the healthcare challenges Americans face at home and abroad, as well as actions for a progressive prescription to improve healthcare for all. Please note that we'll be gathering questions for our speakers from the Q&A box on Zoom and on Facebook, where we're streaming live. You're welcome to type in your questions as we go along. We do have some prepared questions, but if you have questions for our panelists or guests, you also can type them in the chat box, and we'll address them as time permits. Here are 3 facts to frame our healthcare discussion today. Number 1, the US remains the only developed country without a system of universal healthcare. Number 2, the US spends more on healthcare as a share of the economy, nearly twice as much as the average OECD country, yet has the lowest life expectancy and highest suicide rates among the 11 nations. And number 3, during the pandemic, the profits of US health insurers have doubled in some quarters, for example, in the second quarter of 2020. The over 450 Democrats abroad who registered for our progressive prescription event dramatically underscore the intensity of our concerns and eagerness to improve healthcare for all of us at home and abroad. So let's get on with it. We begin with representatives from our DA Global Disability, Seniors and Veterans and Military Families Caucuses, Medicare Portability Task Force, and the Global Progressive Caucus. They will describe their caucuses, the healthcare needs of their constituents at home and abroad, and what is needed for improvement, including their policy priorities. We're going to begin with Marnie Delaney, who is the chair of our Global Disability Caucus. Marnie, the floor is yours.
Thanks so much, Bruce. When you have a disability, you often can feel rather alone, unseen, or misunderstood when intersecting with the healthcare system. It makes most of us quite anxious, which is why too many avoid it to their detriment. This isn't at all unusual. I mean, it isn't all usual, rather, but I have had 18 medical encounters this year so far, and I can attest to the toll of each one and the cumulative impact. And for a lot of people, that's usual. Another reason we sometimes delay, of course, is the financial drain, which is something I'm sure we'll talk about quite a bit today. 1 out of 4 Americans has at least one disability. Some are visible, some are not. 1 billion people in the world do. These can cause impairment in body structure or function or mental functioning, limitations in seeing, hearing, walking, or problem solving, participation restrictions in normal daily activities, pain, discomfort, anxiety, and often things like isolation, discrimination, and condescension. As you can imagine, what is often required is constant vigilance and tackling each day with something, with what sometimes feels like a battle strategy worthy of Sun Tzu. This is also true for our families, our friends, our coworkers, and caregivers. In addition, we experience disproportionate health difficulties, shorter life expectancies, 3 times more chance of arthritis, diabetes, and heart attack, 5 times more likelihood of a stroke, chronic obstructive pulmonary disease, and depression. Women are likely to receive poorer maternity care, less chance for a pap smear test or a mammogram, a much higher risk for severe pregnancy and birth-related complications, and 11 times the risk of maternal death. An adult who is deaf and hard of hearing is 3 times as likely to report fair or poor health. The strongest predictor for COVID-19 infection and second strongest predictor for COVID-19 death is intellectual disability. And sadly, it is unsurprising that all of these disparities and lots more are exacerbated if you are a person of color. In 2019, the National Council on Disability recommended to the LCME the accrediting organization for medical schools in both the US and Canada, the requirement for disability competency and bias training as part of their larger cultural competence and healthcare disparities requirements. Instead, that organization decided not only to exclude disability competency and bias training in its explicit requirements, it also removed its previous gender bias and diverse belief system references. So maybe it's okay that doctors forget to look directly at or enunciate to their patients with hearing deficits when they're asking them questions or conveying important information, or okay that I, as a patient with multiple sclerosis, not exactly able to leap tall buildings in a single bound, am almost always directed to a very high examining table and told to up. And okay that assumptions about the health of people with disabilities far too often leads to dangerous and even fatal results. Or okay that the absence of simple human dignity is a too present reality for people with disabilities. Obviously, it's not okay. There's much to do. The Consortium for Citizens with Disabilities has a list of principles we can definitely get behind. True universal health care, comprehensive coverage of all services, community first care, coordinated care and programs, inclusive quality metrics and reporting, and we'd echo these words: accessibility, affordability, non-discrimination, simplicity, and enforceability. The sad reality today is that whether you are a healthcare refugee from the US, that's me, or an American who wants to and is able to travel to the US from abroad for much of their healthcare, especially if you are someone or someone you care about has a disability, you know things need to change soon and a lot. Thank you.
Melanie, Marnie, I agree. Soon and a lot. Thank you very, very much. And we are going to continue now with Betsy Ettore, who is the chair of our Global Seniors Caucus. Betsy, the floor is yours.
Thanks very much, Bruce. Senior illnesses and mortality have been linked with health inequalities, as health researchers use the term structural violence and social death. Last year, Canadian academics suggested that these terms have clear negative connotations and emotional content, and the term social murder contains even more laden language describing the adverse effects of capitalist-created health inequalities. Using these highly suggestive terms may be useful because, they involve the greater likelihood of evoking public reactions through arousal of anger and class consciousness. While I'm not suggesting here that seniors' illnesses and mortality rates are linked to social murder, I'm suggesting that we need to lessen the adverse effects of capitalist-created health inequalities for seniors, especially those of us living abroad. For the most part, American seniors living abroad are not entitled to receive Medicare benefits for health care outside of the United States. This is why one of the GSC's, that's our caucus's, main priority is Medicare Portability. We believe there is an urgent need for specific legislation to solve this issue. Retirees who are moving to a foreign country cannot use Medicare to pay for health care while they are living overseas. The options for retirees are to buy private coverage, to pay into government-sponsored system in their new country, or to go without coverage. Whatever option they choose, if they return to the US, they will still be covered by Medicare Part A, which covers in-hospital care and skilled nursing facilities, as well as certain care given by home health agencies and hospices. Anyone who is 65 or older and is eligible for Social Security automatically qualifies. Medicare Part B, which covers outpatient services, charges a monthly premium. Unless retirees continue to pay the premiums while they are overseas, they will not automatically be covered by Medicare Part B when they return to the US. Retirees who drop Part B and then move back to the US will have to pay an enrollment penalty. Monthly premiums increase by 10% for each year that an individual is not enrolled. So what does the Global Senior Caucus want? We want the US government to exempt returning Americans over the age of 65 from the enrollment penalty. The penalty is so complex that a DA retiree who's age 67, who worked as a manager for a major healthcare provider, couldn't figure it out. We want the US government to allow senior Americans to come home, especially when a spouse or family member dies. We know of a senior DA member who lived in Canada and nearly died last year during heart surgery. His wife couldn't afford to move back to live with her son, who resides in New Jersey, because of the penalty. Also, we know of a senior DA member's father who recently passed away. His mother is 86 and lives in Massachusetts. He and his wife cannot move back to the US to look after her because of the penalty. And as every year passes, the bigger the penalty. Medicare benefits should be extended to those Americans eligible who live outside the United States. Like other American retirees around the world, we can't use Medicare benefits unless we travel back to the US. Free medical treatment isn't free when it requires the purchase of a plane ticket. Medicare Portability would be a smart policy for everyone. US retirees who've paid into the program should receive the benefits they deserve. Otherwise, they may have to pay travel expenses or pay out of pocket for local treatment. The Senior Caucus advocates for Medicare Portability and is aware that Democrats abroad is in favor of Medicare for all. We will work with other DA members and caucuses to investigate Medicare expansion so that we can realize our vision for a fair future for seniors abroad. Thank you.
Both Marnie and Betsy have offered us some very compelling stories and reasons why Medicare portability, Medicare expansion is so necessary. And we are going to continue now by hearing from the current acting chair of the Veterans and Military Families Caucus, Erin Watson. Please take it over.
Current acting vice chair, but yes, thank you for having us. I'm Erin Watson of the Veterans and Military Families Caucus, and I fit in the family members half of that title. Veterans and military families face a very unique set of challenges getting access to healthcare while living overseas. In many cases, the programs that were created to help veterans, such as Tricare Overseas and the Foreign Medical Program, simply don't work quite the way they should outside of America or off base. And many politicians and pundits find the existence of these programs an easy shield to hide behind, because after all, if this healthcare solution exists, there surely cannot be any barriers to accessing it. We all kind of know that's not true, as demonstrated by the Seniors Caucus and Disability Caucus. The first program available to veterans living overseas is Tricare Overseas, and it functions a lot like its Tricare counterpart in the US. However, it's really only truly accessible if you live on or near an established military installation. If you go to their website, the Tricare Overseas website, and look for a provider, there's really only providers in countries like Germany, South Korea, England, Australia, where there's established bases. But if you're a veteran or a family member living in Turkey or Asia, the wider Asia Pacific region, or Latin America, these Tricare providers may not exist for you. And you have veterans and their families who are welcome to file for reimbursement after receiving care, but it's not quite the same. The other available program is the Foreign Medical Program, but that one comes with even more strings attached. The FMP is operated through the U.S. Department of Veteran Affairs, and it's only available for eligible veterans who are traveling or living overseas and not their families. And it only covers, quote, the healthcare services, medications, and durable medical equipment for service-connected conditions and conditions associated with or held to be aggravating to a service-connected condition. So if you have something that isn't a service-connected condition or unrelated to a service-connected condition, you can't get care through the Foreign Medical Program. And those conditions are determined to be service-connected by the VA, the same department operating the Foreign Medical Program. If a veteran is lucky enough to live in a country with that established American military presence, such as Japan or Germany, they may get on base, and that makes the whole process much easier. But if you're not lucky enough to live in such a country, you can seek treatment locally and file for reimbursement. But this process is onerous and may not be really worth the effort. And we find that to be completely unacceptable. Veterans and their families should be able to access the healthcare they were promised, regardless of where they live in the world. Access to medical care should not be dependent on whether or not your host country has a military installation. It really shouldn't. Our requests are very simple and straightforward. 1, we want Medicare Portability for our elderly veterans who live overseas. Many of our veterans have fallen in love with their host country and in their host country. Their families are multicultural, multinational, and they should not be forced to pick between family and medical care. 2, we want expansion of the foreign medical program to cover veterans and their families living in areas without access to Tricare Overseas providers. And we also want to see it expanded to cover non-service connected conditions. That reading of the foreign medical program is very narrow and really doesn't serve the community as well as it could. 3, we want a much smoother and streamlined process for veterans and their families to file for and receive reimbursements. This should not be a difficult thing. And 4, we want to have the expansion of Tricare Overseas to allow for veterans and their families to have access to care regardless of whether or not they live near an in-network healthcare provider. Our DA VMF advocacy team is working exactly on these issues. And I saw some questions about this already in the chat box. So please, if you have issues with the foreign medical program or access to Tricare Overseas, please send us an email and we will definitely talk to you and see if there's anything we can do to help you. We want to thank ProDA and the organizers for allowing us to join them. And we urge all of you to remember to volunteer, donate to DA. And if you have any issues, please come talk to us. We may be able to help. Thank you.
Erin, thank you very much. As we move along, it's become clearer and clearer that we have a very full plate and we need a little bit more room because now we're going to turn to Heather Stone, and she is going to talk to us as a leader of the Medicare Portability Task Force about some recent good news. Heather, the floor is yours.
Thank you very much, Bruce, and thank you, ProDA, for organizing this wonderful event and for inviting us to join you. So in the summer of 2021, Democrats Abroad launched a Medicare Portability Task Force to ensure that U.S. citizens abroad have access to their earned Medicare benefits, which unfortunately has yet to be the case. However, after much work and negotiation, we're excited to announce that President Biden has authorized a Medicare Portability pilot program as part of the Consolidated Appropriations Act of 2022, which is HR 2471. We have been working with the Governmental Savings Institute, and I want to give a shout out to Philip Blumenthal, who I think is on the call today, to create a pilot program at CMMI to allow Americans to retire overseas or Americans who are already overseas to get the majority of their healthcare benefits in the US to have their Medicare benefits expanded so that they will be able to use such benefits abroad. This was accomplished with the help of Democrats Abroad generally and the offices of the Democratic House offices of Speaker Pelosi, Representatives DeLauro, Boyle, Williams, Bowman, Raskin, Fletcher, and Takano. In the Senate, I also want to give a shout out to Senators Murray, Rosen, and Masto. On Ways and Means, the Ways and Means Committee, we also want to thank Lizzie O'Hara, who is Richard O'Neill's chief, and Oriel and Fabian. This worked because we were able to demonstrate cost savings, family reunification, and reduction in the upcoming forecasted bottleneck in our medical infrastructure. Specifically, the act encourages the Center for Medicare and Medicaid Innovation to consider creative pilot projects that lower the cost of care among older Americans and enable individuals who retire overseas to retain and utilize their Medicare primary healthcare benefits. The pilot should consider potential cost savings involving international collaborations where the quality of care is comparable and less expensive. This pilot program creates opportunity to give cost savings to the government and Medicare benefits to US citizens overseas. We're confident that the pilot data will bear out the economic efficacy and hope that the pilot will quickly be expanded to cover more US citizens around the world. I want to mention that Democrats Abroad conducted an in-depth survey of nearly 5,000 members and in 108 countries, and the data clearly demonstrates the need and opportunity for such a program. But I want to point out 5 highlights. Most Americans living in the near abroad, which is Canada to Panama, let's say, return to the US today for their medical care as they can't afford local care. 18% of Americans living abroad know 1 to 3 Americans on Medicare who would join them if Medicare were portable. 14% of Americans living abroad know someone who would move overseas if Medicare disabilities benefits were portable. And of the non-seniors living overseas, 36% of them have parents or grandparents who would join them if Medicare were portable. And finally, an overwhelming number of Americans overseas indicated that they would not return to the US for medical care if Medicare were portable. I would be glad to share more of these results in a separate in-depth presentation with all of you. And thank you for your help and support in seeing this pilot through to its completion. If any of you want to get involved in the Medicare Portability Task Force to help us with the further advocacy work and ensuring that the pilot program is implemented and then expanded, and to work on Part B issues, which was raised by the Seniors Caucus earlier and other topics, you're welcome to join us and volunteer. You can write to us at the medicare@democratsabroad.org. Thank you very much.
Thank you very much, Heather. It is clear from your work and that of the task force that if we really dig in and be active, do the hard volunteer work, that it can pay off. Maybe as we continue, we'll get to the point where what we're talking about can be something that is available not only to those 65 and older, but 60, 55 and down on the line until we have universal health care coverage. We're going to pivot now to the Global Progressive Caucus and ask Daniel Stein, who's joining us this morning from Mexico, to tell us a little bit about what he thinks. Daniel, the floor is yours.
Thanks, Bruce. So I'm going to share a little bit of a personal story about my own efforts to get medical attention and need for medical attention here in Mexico City. I was injured in a bicycle accident on my way home from work in June of last year. And this resulted in a knee surgery and about a year-long recovery process that I'm still in. For all the terrible insufficiencies of the Mexican police and healthcare system that I did experience, I am extremely glad that this did not happen to me in the US. I was hit by a truck on a rather busy street and was knocked right off my bike. And so what actually happened to me in the very moment of lying on the ground in the middle of the street after being hit by this truck was that I said to myself, thank God this did not happen to me in the US, and I can afford whatever is going to come of this here. And as it turned out, I was able to receive excellent surgical treatment and care in a publicly administered system where my ACL, the ligament in the front of the knee, was repaired and reinforced perfectly. The rehabilitation process was where I came up against systems deeply lacking that don't provide enough for patients, Mexican or otherwise. So I was told that this is also the case in Canada, where when it comes to rehab and physical therapy, most people even go private. The US has more wealth than either of these two countries and could certainly put together a system with which we can treat and rehab such injuries. It's simply a matter of changing incentives for every part of the healthcare system. Separately, I've seen people go to Mexico for dental care that insurance did not cover. This was the case with my ex, who flew to Mexico City twice from Chicago in order to receive treatment because 2 round-trip plane tickets and the cost of treatment in Mexico were cheaper than 1 surgery in the US. Besides the ludicrous nature of this reality, it also adds to climate change without even skipping a beat. So whether we're traveling to other countries for cheaper medicine or we're Medicare recipients returning to the US because Medicare hasn't yet been made fully portable, and again, thank you to those of you who've worked on getting this pilot program started, we are contributing unwillingly, I'm sure, to climate change and ultimately damaging our health and that of our species in the process. And in that vein, I'll share a small action that we can all take regarding climate change as a healthcare issue at the end of our time today, so that we might have the greater information and transparency regarding what is arguably the most significant threat to our health, even if it isn't always the most urgent. I'll just close with noting that the efforts to create or to establish universal healthcare and Medicare for all are things that the Progressive Caucus has long stated their support for, and we have long been in support of the DA resolution, the Democrats Abroad resolution that was passed in 2019, supporting the Medicare for all legislation. And with that, I'll turn it back to Bruce, and thank you all very much.
Daniel, thanks to you, and thanks to all of our caucus panelists for those excellent remarks with great action items. At this point, we're going to start the next segment of our program, and I will pass the baton to our Vice Chair of Pro-DA, Sue Altsness, who's with us in Toronto today. Sue?
Thanks, Bruce. Wow, our speakers really gave us a comprehensive overview of healthcare issues facing Americans at home and abroad. You all have demonstrated so well the effective advocacy work that Democrats Abroad volunteers are doing on behalf of all Americans, and the policy needs that we can influence by engaging with grassroots efforts in voting, particularly in primaries when we have a chance to select the Democratic candidates who most closely align with our values and have a strong chance of victory in general elections. So we're seeing how DA is a formidable force at generating votes from overseas to tip the scales for Democrats. Just look to Georgia and our hold on a slim majority in the Senate. While our volunteer time and talents have no financial cost, we need funding to support our tools for reaching voters by email, mail, purchased advertising, and phone banking. And right now, we have a matching gift opportunity currently for donations through the Progressive Caucus donation page. And the donations directly support the resources mentioned above. Leading up to this event, you doubled our progress toward meeting our match. And we only need $534.34 to meet our match. So when we do that, our anonymous donor will release $2,500 to match your donation. So we're just going to drop the link into the chat so that you have that. We're so excited about the donations that have come in so far, and didn't want to miss this opportunity to let folks know about it. So now we're going to switch our focus to our invited speakers from outside Democrats Abroad. And they're experts in this area of progressive healthcare. We're going to start with Eagan Kemp. Eagan is an expert in healthcare policy, including single payer systems, private health insurance, Medicare, Medicaid, the Children's Health Insurance Program, the Veterans Health Administration, the US Food and Drug Administration, social determinants of health, mental health, and drug shortages. He's served as senior policy analyst at the U.S. Government Accountability Office. And since joining Public Citizen in May of 2017, much of his time has been devoted to fighting cuts to healthcare coverage. Thank you, Eagan. All of us in Democrats Abroad were with you on that fight during the last administration in the White House. And Eagan's also been pushing for Medicare for all and for lowering drug prices. So Eagan, perhaps you could start with sharing your responses to the issues and concerns shared by our panelists from the DA caucuses and the Medicare Portability Task Force. And we'd love to hear an update on current initiatives related to executive orders and federal and state legislation to improve healthcare and healthcare access. Thanks, Eagan.
Yeah, thank you, Sue. And thanks so much to Democrats Abroad for having me today. I appreciate all the great work you folks are doing for a whole variety of issues, but especially on healthcare, given your unique perspective in experiencing healthcare systems vastly different from what we have in the US. And just sort of one piece, that isn't on my public introduction, but is really crucial was my experience as a grad student in Canada is really the thing that radicalized me on healthcare and helped me understand sort of most fundamentally that healthcare doesn't have to be as hard as it is in the US, that I was honestly shocked and confused at how easy it was to get healthcare in Canada, and which was a huge difference where I was coming from in the year between undergrad and grad school, where I had a $10,000 deductible, high deductible plan where it was almost useless to have, but if something catastrophic had happened, maybe it would have helped a little bit. And I really appreciate the previous speakers. Thanks so much to Bruce, Marnie, Betsy, Erin, and Heather. You guys really highlighted so many key issues that I think we need to, deal with. And Daniel's, personal story really got to the heart of how many Americans have thought that same thing, either when they get injured in America or get injured abroad, either thinking, oh God, am I going to be bankrupt? Or, oh, thank God, I got hurt in Canada versus the US. I mean, and you hear horror stories of folks coming to the U.S. from abroad and needing to put cash on the table if they break their leg skiing or something like that. It's really a dystopian at times. I think one of the things that's important with the issues raised by the various caucuses, Medicare for All would improve most of those issues discussed, but some, because Medicare for All is still, the legislation is still being filled out every year, every session being made more detailed, it's important to make sure that Democrats abroad are getting their perspectives in there. One of the things that's crucial for Tricare and VA is right now in Medicare for All, they would be sort of supplemented with Medicare for All as opposed to being replaced. And that's going to be a crucial piece for folks to have sort of peace of mind in any Medicare for All transition. Right now, there is some information about what would happen for Americans abroad, but that could be made more explicit in any sort of future versions of Medicare for All, because it is crucial for Americans to have peace of mind as they're thinking about what Medicare for All would look like. And I really think it's important what Heather highlighted about the portability pilot. One of the things that we should want is people being able to choose where they're living because it's where they want to be, as opposed to where they know they can get the healthcare they need. And so it would really make a huge difference for Americans to be able to join their family members abroad and actually be able to get the care that they need and that they've paid into many times throughout their life. So no, these are crucial steps, and I'm excited to see the work that you're doing, and also happy to pitch in where helpful, because these seem like really important efforts. And so one of the things that I was asked to talk a little bit about is the Congressional Progressive Caucus is having a big push around executive orders more generally, but has a number of them within the healthcare realm. One of the challenges that we're going to face in the next few months is the turn from members of Congress focused on legislating to members of Congress focused on getting reelected. And that's going to mean a real change and focus on the Biden administration for executive actions. And so they've have a number of sort of buckets, and I'll put a link in the chat for folks to be able to see sort of all of the pieces. But in healthcare, there's sort of really three key areas. One they're calling ensure access to healthcare for families, one focused on lowering drug costs, and one focused on decisively ending the global COVID-19 pandemic. And each of those pieces have, different factors. The ensuring access to healthcare for families, one of the sort of easiest changes that the Biden administration could make is, and which would help 5.1 million Americans, would be to fix what we call the family glitch in the Affordable Care Act, which is basically how eligibility is determined for premium subsidies. Right now, it's sort of a complex thing, but at its most basic is that it's based on whether it's affordable to the employee versus whether it's affordable to cover their entire family. And that really has set up a situation where many folks, it may seem affordable based on the definition that's being used now, but is actually not affordable. And so that would be a big change that would have a huge effect. Another key piece that the Biden administration has already taken some steps on, but we think must go further, is to end a program that was started under the Trump administration that would put Medicare on the road to privatization via some pilot programs. It would move some seniors into private, what we call direct contracts, something that their provider would have signed. And now would be the incentives to restrict care, unlike what they would be having under their traditional Medicare, which they chose as opposed to being in Medicare Advantage. When it comes to lowering drug prices, there's a number of things the administration could do to use existing legal authorities to lower the cost of essential drugs, including insulin, naloxone, hepatitis C, HIV/AIDS drugs, Xtandi, EpiPens, and inhalers, among others. There's also a big push to build public manufacturing capacity to ensure the availability of crucial drugs such as insulin at a much lower cost than we pay right now. And then also, protect taxpayer investments and lower the drug prices in general by requiring all government funding contracts to include reasonable pricing clause. This is something that would allow us to keep drug prices low, because we're already doing so much of the investment as sort of the American taxpayers in doing the research to get the drugs that we need. And then finally, in that section, making medication cheaper by allowing personal importation of drugs. I can tell you, as a resident of Salt Lake City, Utah State sends its state employees on buses to Mexico to get their drugs and has them stay overnight there so that they can, the state can save money on its cost of drugs. So obviously, we're seeing importation happen by various means, and I know other states do similar things. And then when it comes to ending the pandemic, there's a number of things that could be done, whether it's public manufacturing of vaccines and therapeutics, whether it's increased funding for global emergency or for global access to COVID-19, securing global emergency waivers on monopoly rights for COVID-19 vaccines and other treatments. It's really a time where we've got to, the US needs to lead on addressing global COVID-19 so that we aren't just, constantly facing the waves that I know we're going to continue to experience until we really get this handled. So turning briefly to some legislative efforts, just to give you folks a flavor of where we are on a number of key pieces. So most importantly for my work, and I know lots of you in DA are excited about this, is the forthcoming launch of the Senate Medicare for All bill. Timeframes are still being worked out, but it'll be an important time to turn the discussion back to the healthcare system we need, instead of just tweaks to our broken healthcare system. As folks will remember, when the House bill launched last year, we launched with a record number of original co-sponsors and have added a number of additional co-sponsors over the course of the past year, have had exciting hearings, have had a push for Medicare for All, but it's going to be a real full court press when it comes to the Senate. Senator Sanders releasing his bill, fires up the media in a way that few other things can. And so Brittany will talk a bit about some of the steps that can be taken, but I just wanted to flag a couple additional things that, Dems Abroad are in a really unique position to do. Having you folks, both as an org and as individual members, reach out to the senators in the districts in which you vote, and even reps to see if they, want to co-sponsor or make sure they've co-sponsored, and thank them for co-sponsoring. Also publishing op-eds in local papers of the districts in which you vote. It can bring a unique and valuable perspectives to Americans who are just too used to the status quo. Another piece that I think many folks were probably following was Build Back Better and some of the positive Medicare expansion pieces, as well as the stuff that would have lowered drug prices. And obviously there's a lot of disappointment and frustration around Build Back Better. It does seem like there's some potential for drug pricing wins in whatever the reconstituted bill, as Manchin has expressed support from them. So there will be some important steps to take, and we welcome folks to engage once we have a better sense of what that bill ends up being, once Manchin and leadership can get their ducks in a row. Another crucial piece is state efforts on single payer healthcare. New York and California get the most attention on this and are most commonly discussed, but there's a number of other states that are engaging on single payer and are at various stages of single payer bills and various sizes of single payer movements. It's worth looking into what's going on in whatever state you vote in to see if there's folks you can plug in with and engage with. We anticipate a lot of excitement over the next coming years in there as well. It's obviously, also important to be building rapport and positive pressure on state reps and local officials, because many of them will attempt to move into higher offices or other positions within the Democratic Party. It makes strategic sense, and it also helps you, get used to working with members across sort of the spectrum, and it will really help them hear your perspective, because you guys bring such a unique and valuable perspective. So I'll stop there. Thanks again for having me, and I'm happy to take any questions when the time comes.
Wow, thank you, Eagan. We're getting really close to the question time, and we have a ton of questions coming in. So I'm really proud of our panelists and speakers that we're actually ahead of time, which is amazing. And so you can use the Q&A chat to add more questions to our list. You might want to also take a look at the questions that are in there, so you provide some new questions. Our next speaker is Brittany Shanahan, and Brittany works as an organizer for Public Citizens' Medicare for All campaign. Brittany studied and worked for 8 years in the UK and spent considerable time with the climate camp movement before returning to the US. Her primary focus is working with activist groups around the country to pass municipal resolutions in support of Medicare for All, and using the resolution strategy to build stronger activist networks and social movement infrastructure at the regional, state, and national level. Brittany, thank you for joining us today. We want to hear more about this. Democrats Abroad passed a resolution supporting Medicare for All in 2019. We were pretty excited to be one of the first state parties to do so. And we let the folks of Public Citizen know right away when we passed it. We were in touch with you and had a speaker from Public Citizen, Melinda, the day before. Hi, Brittany.
Hi, yes, thank you so much for having me. I'm really excited to be here because my experience living in a country that guaranteed healthcare to everyone played a profound role in directing me to work on this issue when I moved back to the United States at 27. So I've actually got my University of St. Andrews polo shirt, rugby shirt. Don't cancel me, I've been gone for a while. That from 2004, sort of to mark that. And so when I moved back at 27, for the first time in my adult life, I realized the financial dangers of being uninsured or underinsured. And so we've had a lot of great presentations so far now on policy, and I understand there will be a Q&A session later. So for now, I'm going to focus on some ways that Eagan actually touched on a little bit, that you as Americans living abroad can be a really crucial part of this movement to win Medicare for All. So let me just share my screen. I believe it's this one. Is it sharing a presentation?
Yes, it is.
Wonderful. Okay. All right, great. So since the vast majority of developed countries and many developing countries guarantee some form of universal health care, Americans who are living or who have lived abroad can offer a crucial perspective to say that a single payer system is both A, achievable, and B, desirable. So, There we go. Americans without this kind of international experience often interpret universal healthcare as some sort of utopia. Meanwhile, if you talk to someone on the street in France, Brazil, Taiwan, Australia about the United States healthcare system, they tend to see healthcare as like an everyday commonplace right that comes with modern democracy, and they don't understand why the US hasn't fixed this. So one of the first tasks at hand is to address a common narrative that exists in the United States that single payer systems, particularly those found in Europe and Canada, because for us, our international attention is usually that Europe and Canada and Mexico exist and not many other countries do. So that's why the narrative focuses on these countries. But there's this idea that the healthcare systems in these countries are death traps. So there's two reasons for this. One, there is a long-standing movement against universal healthcare in the United States. And this movement, it's crucial to say, goes all the way back to segregation. And it goes all the way back to the rights advocated by the American Medical Association to not treat certain types of people. This is a very crucial part of the history of our broken healthcare system. So, and that has fed into this belief nowadays that like you have to earn the right to be treated if you're sick. If you're sick and you can't afford it, it's your fault. So that's one problem. The other problem is like headlines like this one that I've included on the left from the Daily Mirror. They can be taken out of context very easily if you're not from the country it was printed in. So people who live in countries like the UK with guaranteed healthcare systems care passionately about healthcare as a matter of national pride. But to the American outsider, a newspaper cover like this can look like a diatribe against the NHS, rather than what it actually is. It's an attack on the present government at the time it was printed, saying this government doesn't care enough about the NHS and the NHS is failing because they're not funding it. But if you ask British people, like most polls show that 90% would rather keep the NHS than get an American style system. But nobody ever talks about that. We just hear about waiting lines, all these things. And so like here's an example of something that I did a few years ago. There was on the right, there was an op-ed, and this happens all the time. There are these people who work for right-wing think tanks, and all they do is they write op-eds and submit them to local papers about why Medicare for All is terrible, why it would end up why it's a death trap, why the single payer systems in other countries don't work, and that's their job. So I saw it in the local paper, and I wrote an op-ed in reply saying I actually lived there. I protested against the cuts to the NHS, and also pointing to the reality that exists in Europe is that, and in the UK in particular, is that issues with the NHS go back to a long-standing history of privatization and neoliberalism that you could point at Tony Blair's Labour Party. And this is an issue of domestic. This has to do with funding and domestic politics rather than whether or not a single payer system works. But anyway, writing a letter to the editor, I included this bit because the points made in there are points that any American living in the UK could probably make. You don't have to be a policy expert in order to make them. And I've included some pics, and I'll put the link after my presentation in the comments section. I think one of the best guides to writing an op-ed is actually with one of our partners, Physicians for a National Health Program. So they have this really great op-ed how-to guide that you can use to just, the local paper where you are from, you can write to it. You can write a letter, you can write an LTE, especially with this Senator Sanders bill coming out. Writing an op-ed to them, submitting to them about, your experiences if you live in a country that provides healthcare and what that has meant for you and your lives and your life. That is a viewpoint that is not, it's not prioritized in this country, and it should be. So that's one way. Another way is we do have this, my main work is working on the Medicare for All resolutions campaign. So we've passed 96 city council and county board municipal resolutions in support of Medicare for All. This is part of an effort to make what is a piece of federal legislation more locally accessible in terms of building local social movements. It's worked out really well there. So another way that you can help is if we have, say, all meetings now are virtual and are likely to be virtual for the foreseeable future, which means that you can attend a meeting, either a meeting with a council member, with activists from the town or the area you grew up in, or you can testify when the resolution goes for a hearing. And so you can get in touch with me. I don't know if I'll keep putting my email in after my presentation, and it would be great to connect you with local activists who are always looking for people to give testimony of this kind. And again, because everything is online, there's an accessibility that wasn't there before. The reason why we do the local resolutions is just that, it seems like it's not much, but the important thing is that we're organizing. We're organizing on the ground. We're building these hybrid local coalitions and using it to build power, bringing these coalitions into these meetings with representatives and senators to show that there is a local demand for this issue. And my constant point here is like how much any American with experience living in a country with universal health care can offer this. Because what you can say is that I lived in this country and it's normal there. What you're talking about is impossible is normal for other people, which is something that is rarely vocalized. So yeah, I think, how am I doing on time?
Oh, sorry. Yeah, you're good. You've got another minute and a half if you want it.
Okay. Why don't I wrap up, because there may be some questions about the legislation and then I'd be happy to answer them. So let's do it that way. Thanks so much for having me.
Okay, awesome. Oh, thank you, Brittany. Oh boy, folks, we have a lot of questions. I apologize that I earlier thought you could see them in the Q&A. It's only visible to the panel, I guess, for most of the questions. So, okay, so let's see. We're gonna go through these quickly and ask the panelists to jump in if you want to address a question. So we have one for Heather, which is with the Medicare Portability pilot program, is it possible to participate? When or how? Do you know? Oops, sorry, I just got muted. The question is to Heather, how can members of DA participate in the Medicare Portability pilot project?
Okay, well, it's a little premature because we don't yet know what the scope of the pilot program will be when CMMI puts it together. But we expect that there will be between 8 and 10 countries in the pilot program. Probably several in the near abroad, somewhere between Canada to Panama. Probably a few in Asia and a few in Europe. We don't know which countries, and probably a country in Africa, maybe 2. And once those are determined, we'll also see what the balance will be in terms of the starting point of how many Americans they're going to put into the pilot for each country, and how it will be developed. And I think the initial focus is going to be on trying to get Americans who are in the US to go overseas, and then an expansion to include Americans who are already overseas. But we don't yet know how it's going to be structured. We're going to have our finger on the pulse and be involved in the process, but it's all very exciting.
Okay, thanks so much, Heather. So here's another question asking, which pilot program is investigating the penalties imposed on someone who has lived abroad for several years and then returns to the USA to live? What is actually involved with paying, quote unquote, into the system?
That's really a question about the Part B payments, and that's going to be like a next step for us in the Medicare Portability Task Force. We're going to be looking at that together with the Senior Caucus. It's something that Betsy spoke about. So maybe Betsy wants to jump in, but I know that Tony, who is on both caucuses. She's our point person from the task force who's on the senior caucus, is going to be heading up a group to be looking at the Part B penalties.
Awesome. Okay, I see Tony has shared a link to a newsletter, and maybe someone on the panel, maybe Karen, you could share that with everybody in the chat. So we have another question here in the Q&A. This person says, I live in the UK and I use the NHS. It's a total disaster. Universal healthcare is not the answer in itself. It must be a system with accountability. Who wants to take that one on?
Yeah, I think that is a crucial point, that the sort of the experiences that folks have abroad. I mean, no healthcare system is perfect, and we definitely know that. And, as Brittany talked about, many healthcare systems internationally have experienced, the same sort of privatization push that we've experienced in the US. Most of them have means to push back in a way that the US healthcare system just isn't able to do. And so that's why we see, profit so much more rampant in the US healthcare system than in any other comparably wealthy country. And so as we're building the Medicare for All system and, identifying what the needs of folks are, that's another crucial piece, that folks who are experiencing healthcare systems abroad, where are the problems that you've highlighted? I mean, when I was living in Canada, that was also a crucial part of sort of my, education on their healthcare system, was where the failings were, and around things like prescription drugs, around things like wraparound benefits for folks that are unemployed. There's all sorts of those challenges, and we want to make sure, as we're building, the best Medicare for All system that we can, we're taking into account where other healthcare systems, have challenges and failures as well.
Okay, here's a
Yeah.
question. Oh, sorry, someone else?
Yeah, it's just me again. I just wanted to jump in real quick and reiterate the extent to which the NHS has been privatized and defunded by successive governments, especially however many years of conservative leadership they've had since 2009, when David Cameron introduced his plan for the NHS. Many people said would happen, exactly what did happen. And also, I think there is an important distinction to make between the NHS is the doctors are paid for by the government. Under Medicare for All, that would not happen. And so what that means is that when the government made these big cuts, it meant that there were less doctors and nurses serving patients across the board. That kind of issue would not be the case with Medicare for All. And just finally, I think it's also important to separate the trauma that some people receive from underfunded healthcare systems not working as they should. Separate that from the reality that people have in the US, where it's like no one in the UK that I know of has ever declared bankruptcy at the age of 22 for breaking their arm, whereas I had a friend do that. And so I think, the great thing about Medicare for All is it is based on several decades of study of all the things that have gone wrong in these other countries with single payer systems, and a determination to make sure we do it right. I'm pretty confident that our bill, once it's passed, it will probably be the best healthcare system in the world.
Okay, thanks, Brittany. I have a question that might be good for you to address as well. So this question says, can municipal Medicare for All resolutions create a horizontal diffusion tipping point that, like with other issues in the past, motivates federal legislation change? That kind of concept is addressed by Jennifer Lawrence, that phenomenon. She talks about that as a spokesperson for Represent Us and their anti-corruption work in politics. Is that something you see happening with Medicare for All?
Yes, absolutely. And the strategy draws from the campaign about 10 years ago with Move to Amend that Jennifer, I think you said, was probably thinking of when they wrote that. And Move to Amend passed something like 800 city council, county board resolutions in support of a constitutional amendment to overturn Citizens United. Some colleagues worked on that campaign, and a lot of us as public citizens see that part of base building is like a crucial part in the evolution to what is now HR 1, the For the People Act. I would agree, and so that's why we're doing this. That's the exact reason why we're doing this.
Okay, thank you. That's great. I'm just taking a look at our questions. We have so many. Oh my gosh. A lot of them are very specific to people's situations. Here's a question. Isn't it a big obstacle to Medicare for all, the existence of for-profit structure for American healthcare? Doesn't that structure have to be changed first? Doesn't the cost of a medical education contribute to this significantly? One reason medical care is so available and affordable in Western Europe, with which I'm familiar, is that education is free or nearly so, including up through graduate school. So it's kind of a two-part question around the sort of for-profit structure and the cost of medical school.
Yeah, those are both great points and really crucial to sort of how we think about, moving forward. I'm going to actually take the second one first because that's something that has been, we've been discussing with both House and Senate folks around what funding of medical education looks like under Medicare for All, and the both offices, both the Representative Jayapal and the Sanders office, have been seriously looking at, adding medical education more explicitly into Medicare for All bills, because it is a crucial piece that doctors make more on in most specialties in the U.S. and part of that, but a big part of sort of their income is going to their huge their huge debt from getting their medical degrees, and so having bringing down the cost or sort of funding those degrees through a Medicare for All system is one of the things that's on the table. And your point is well taken about sort of the challenges of a for-profit healthcare system. I mean, the way I think about it is there are certain pieces that you're going to have to address sort of as Medicare for All is coming online, and being able to control via things like global budget, via things like fee for service, controlling the price of services are going to be a crucial piece for cutting the profit out of the healthcare system, as well as in Medicare for All legislation, limits or outright bans on healthcare dollars, Medicare for All dollars being used for profit. That it's a very challenging system to tweak in pieces because it's so fragmented. So if we're able to take on, profit in one piece, there's still, the other 15 pieces of the US healthcare system that are still driven by profit. And Medicare for All allows us to sort of bottom line that almost all care would be funneled through the Medicare for All system, which would have significant restrictions and prohibitions on profit.
Here's a related question, which has to do with how does the proposed, this person says single payer systems like Medicare for All seem to make a lot of sense, but the US currently doesn't have that. We have a not universal multi-payer system. And how does the proposed legislation handle restructuring the multi-payer system into a single payer? How long will it take to switch? And what is supposed to happen to all the people working for the private insurance companies?
Yeah, those are all great questions and important pieces. So the Medicare for All system, depending on sort of the legislation, it's between sort of 2 to 4 years, depending on if you're looking at the House or Senate bill that transition would take place. There's some discussion and debate about sort of how quickly HHS and some of the other pieces would need to develop the regulations, come up with sort of the additional pricing structures. I mean, one of the important things to keep in mind is that when Medicare was originally rolled out, it was rolled out in about a year, and most seniors got on it. And that was obviously a time of much less, everything's on paper. There was not sort of the electronic components that we could be, setting up ahead of time. And one of the important things is to think about, the way I think about it is that we're taking the system that works best right now, which is Medicare, improving upon it and expanding it. And so we already have sort of the fundamental structures in place. We would just need to improve on them and expand them to everyone in the US. And obviously that is going to have a big effect on the insurance system. And that's why both the House and the Senate bill do have entire provisions around sort of the transition, a just transition for the workers in those industries, having funding set aside for retraining. The other important thing to keep in mind is under a Medicare for All system, much of the sort of administrative stuff that was no longer necessary for insurance will go away, but there will be new government jobs created for some of the pieces that will be necessary under a Medicare for All system to ensure that there's the accountability that people had talked about and sort of mechanisms by which folks can engage their healthcare system in sort of for accountability reasons in a way that they just can't do so right now for their private healthcare.
Oh boy, okay. Someone's asking, what do we think? Sorry, I lost my place. Where's that question? Oh, what do you think will happen when Republicans retake, if Republicans retake Congress in 22 and 24?
That is a great question. I think Ron Johnson accidentally showed his hand by saying they would try to overturn the ACA, and so I think we need to take that very seriously. He then walked it back because it was so unpopular, but that's the reality. They don't have a plan for healthcare other than privatization, and obviously, as we saw in the Trump administration, one of their biggest steps around healthcare was this direct contracting entity contributing to the privatization of Medicare, and that's where they're going to go. And perhaps sort of most telling is the person that was developing the policy within the Trump administration had a company that would then be one of those companies that were doing the direct contracting entities. And he was even meeting with the people in his company as part of his official time. So the corruption within the Republican Party is going to expand if they do take, one or both and of the members of chambers of Congress, and they will try to block anything positive. So it's definitely going to be crucial to make sure that doesn't happen.
Well, here in Democrats Abroad, we're going to be working very hard to ensure that Democrats stay in power and hopefully pick up some seats, and a few progressive Democrats who are supporters of Medicare for All will get elected as well. So we'll keep working on that. And I have a question that concerns veterans. I think Erin addressed this, but maybe you know the answer, Eagan. I think you mentioned this maybe. So there's a lot of concern among veterans and their family members that Medicare for All will threaten and dismantle Tricare. Many people prefer Tricare for having a wide variety of plans and many healthcare providers. Some have said dismantling Tricare in favor of Medicare for All will hurt troop morale, retention, and recruitment. Are these concerns being addressed in current Medicare for All proposals? And if so, how?
Yeah, there are a number of folks that have raised these concerns, as well as around sort of VA, the Veteran Health Administration, as well as around Indian Health Services. And the important thing to know is that Medicare for All is really about sort of improving the access to care that folks have. And so there are specific provisions around Tricare in terms of sort of the ensuring that the pieces that are working well are continuing, but also using Medicare for All as sort of a wraparound for additional services that would be sort of available to all Americans. And I think, there will be, one of the nice things about Medicare for All is there's sort of a better coherence between different pieces to make sure that, if folks are feeling like they're falling through the cracks or facing challenges getting the care they need, Medicare for All is able to be more responsive and nimble than sort of our hugely fragmented healthcare system. And when it comes to VA and IHS, because of those concerns right now, they will sort of exist as they do, but again, with Medicare for All as a wraparound. So folks that are getting the care that they need through IHS and are fully set will be able to continue to do so. But folks that are maybe further away from IHS facilities or from VA facilities would be able to get care through the doctors and facilities of their choice, just as any other resident of the US will be able to under Medicare for All.
Oh, thanks, Eagan. Here's a question, a related question, but it's sort of from the other side of the looking glass, if you will, that people who are opponents of Medicare for All may also be opponents of the medical care provided through the VA. So instinctively, this would make veterans and progressives natural allies in this fight. And how many and what opportunities are there for veterans to add their knowledge and expertise to the discussion? Where can progressive and liberal veterans and family members join as volunteers in the fight? That's the question.
Yeah, that is a great question, and something that we do see a lot of support. Vote Vets is a great group that does support Medicare for All and engages a lot of more progressive veterans or veterans sort of focused on this healthcare issue. As you mentioned, Sue, in my introduction, one of the jobs that I worked on while I was at the U.S. Government Accountability Office was focusing on VA and really the challenges and the privatization efforts that were being undertaken by various administrations. And the real danger there is VA has such a unique series of expertise for folks coming back from different types of conflicts with different types of trauma than sort of the average American has. And so it really does serve a very specific and valuable purpose. And we need veteran voices to help, identify, where are the gaps? Where could Medicare for All in that sort of wraparound be most useful? I mean, the piece that I was focused most on was mental health care, and it was really challenging for veterans to get the health care they needed if they were sort of outside of the catchment of a typical VA facility. And so it's really important for us to be thinking about, how do we make sure that the folks that will be seeing veterans outside of VAMCs have the training that they need within a Medicare for All system to be able to provide the care that those veterans are going to need when they come home from conflicts.
Oh, thank you, Eagan. There's quite a few questions from folks about how to apply for this, how to apply for that, different barriers people are encountering. And so I want to share with our panelists and other folks listening that it sounds like we need a session. DA needs a session on specific Medicare questions, or maybe some mechanism for helping people with those. This question relates to that. The person says, I understand that this relates to seniors. So I understand that if you have employer provided coverage, you need not sign up when you're first eligible for Medicare, and that you won't be penalized if you sign up at a later date. I have also been told that this does not apply to people who have overseas insurance through their employer. In other words, they'd be penalized if signing up for Medicare after the eligible period. So Heather, you might know about this, but the person is asking, is this a good argument to make to expand the opportunity for returning Americans who want to sign up without penalty? Do you have a response to that, Heather? Do you want me to say it again?
Well, actually, maybe Betsy has some input here, but the delays, there are some instances where you can take a delay. For instance, if you haven't taken your Social Security. Okay. But if you have taken your Social Security, then and you don't start your Medicare, then you start to incur the penalties. That's what I understand. And that's one of the reasons why the Part B penalties that are something that we want to try to look into, because they are unfair for Americans who want to go back to the United States. Betsy, do you want to add something?
Yeah, I did, because about 2 weeks ago, I looked on the Social Security website and I saw in little print that if you have paid into a foreign healthcare program, not necessarily insurance, but a foreign healthcare program that's universal, that they will count that under the Medicare Part B kind of penalty. So you don't have to pay the penalty if you've actually paid, like, say, in an NHS system. That's what I read, but I haven't really confirmed it, but that's what I read on the website. But I don't know, because why don't people then do that when they get the penalty and say, hey, I've paid into this foreign health plan. So it's something I do have to look into, but it seems that it might be hopeful.
Okay, well, it requires more research, because it's not something that I'm familiar with either. And I think we both would have heard about it if it were in fact true. So I think it's a subject for our team with Tony, and now we have new people signing up, so we're going to have researchers and so forth. So it's great.
Great. Yes.
Oh, boy. Wow. That was a wonderful round of questions and answers. Thank you to our panelists and guest experts today. And we're going to move into our action proposals portion of the meeting. We've already heard about some actions that we can take. And Daniel's going to just, I'm going to ask Daniel to unmute and walk us through very quick takes from each of our speakers on specific actions we can take. And then Bruce will wrap it up for today. Daniel?
All right, thanks, Sue. So we are going to start off our final comments and action plan proposals from the Disability Caucus with Marnie. If you can tell us a little bit about what action steps people can take from your end.
Well, thank you, Daniel. Well, for one of our big word for the year is accessibility, and I think we're really concerned about making sure that DA as an organization is very accessible to all its members. Importantly, this year also that voting is very accessible to all of our members and to the other 8 million plus Americans who aren't members. So that is definitely an action item, is to get involved in everything Democrats Abroad is doing to get the right people elected. Or the picture that was just painted of what might happen with the Republicans, and just I'm really feeling ill. So that's what and so if you can join the Disability Caucus, that would be a great action, because we're brand new and we need people to help organize all the work we're going to do towards accessibility. And then more specifically on the issues we're talking about today, the ADA is something that Americans for Disabilities Act is something that we think is done, but there are attempts to undermine it that happen every year. So that is something we're keeping our eyes on. And the ACA, as was brought up earlier, it was very important. I couldn't get insurance without the ACA when I was in the United States. So, I mean, I very passionately believe that is something that we can't let, it really needs to be protected. So I would say join the caucus, get involved in voting, and watch what those rascals are doing in Washington.
All right, well, thank you very much, Marnie. We're going to turn now to Betsy and what the perspective of the Seniors Caucus is on action steps we can take. Go ahead,
Thanks
Betsy.
very much, Daniel. Okay, so this is something that Heather's mentioned, Medical Portability Task Force. And as a liaising with that task force, the seniors are setting up a newly established Medicare Plan B committee. And as I say, we're liaising with Heather's group, and we're going to look into it. We have already a group of people. We're having our first meeting on Thursday, the 14th of April. If you're interested, please let us know. Write an email with the heading Medicare Plan B Committee. The email would be seniorscaucus@democratsabroad.org, and we'd be very happy for you to join. We need a lot of people, and as Heather was saying, we need to do more research in this area. We want to be absolutely clear on how we can help you all to overcome some of the problems and issues that you've encountered. But so again, I'm going to ask also join the Senior Caucus as well and become a part of this committee. Thanks very much.
Absolutely. And we're going to take a moment now to hear from Bruce and what the Progressive Caucus's action steps are for this issue. If you want to go ahead and take over, Bruce, the floor is yours.
Thanks, Daniel, and look for some of the links to appear in the chat now. Number one, watch for Senator Sanders' reintroduction of Medicare for All, and get involved urging your senators to sign on as co-sponsors. Number two, explore National Nurses United Medicare for All campaigns all over the United States, and volunteer. And number 3, take part in Medicare for All resolutions locally. I want to yield 1 minute of my time to go back to Brittany to talk a little bit about joining public citizens in their campaign.
Oh, yes, sure, absolutely. So I'll put my email in the chat again. I think someone just put up our resolutions campaign. Yeah, absolutely. If you sign up for that and you let me know where you grew up or where you went to college or what area you're most associated with in the country, I can try and connect you with activists there who, whether it's for a resolution or whether it's with lobbying with the upcoming Senate bill, or whether it's lobbying with members of Congress, I can definitely, your perspectives are definitely very valuable there. So I can make that connection. And then the last thing is, yeah, so NNU is coordinating the, through their Medicare for All, they are coordinating a sign up form for Senate visits, but you can also email me and I'll take care of it. I'll just send you to them. So
Thank you very much. Those NNU people also are working at the state level. I know as a voter in Illinois that they are gathering the forces to encourage Senators Durbin and Duckworth to sign on as co-sponsors, and NNU can help us get the show on the road in various states. All right, back to you, Daniel.
All right, thanks, Bruce. So I am going to share a little bit of the Veterans and Military Families Caucus and their action steps. Erin had to leave. I think her time zone reality makes being here now a little bit too difficult. So the Veterans and Military Families Caucus, which I'm not personally a part of, but I will share, would like to let people know that the advocacy team there is collecting data on people experiencing issues with Tricare. So please do, if you have the opportunity or need, please reach out to the Veterans Caucus. The Veterans and Military Families Caucus can be reached at vetcaucus@democratsabroad.org. I think that just got put into our live chat Q&A feed. And you can also join their caucus as well at democratsabroad.org/V for veterans MF, VMF. So democratsabroad.org/VMF. And again, email them with any issues you might be having with Tricare to help them collect data on problems there at vetcaucus@democratsabroad.org. And with that, we'll turn back to Heather with the Medicare Portability Task Force for some final comments on what can be done there to take some action. Go ahead, Heather.
Okay, well, I will just echo what Betsy said. We're very excited with the inclusion of the pilot program in the omnibus legislation, and we are looking forward to following this through and monitoring its implementation. So we welcome any and all people who want to join the task force and be involved in that activity, as well as people who want to join us to be involved in our next steps, which is going to be working collaboratively with the Seniors Caucus on such issues as Part B and the penalties. I think we would also like to be working with the Veterans and Military Families Caucus on issues related to Tricare and how their care can also be coordinated with Medicare Portability. So we look forward to working together with the other caucuses that have been participating in today's panel. Everyone is welcome to sign up with us and get more information, be involved as much or as little as they want, but hopefully a lot. Come to the meeting that Betsy noted on April 14th and be involved. And I look forward to hearing from everyone. Thank you very much.
All right, thank you very much, Heather. I hope that we'll be able to see people get involved a little bit more and maybe even expand what the definition of family reunification means when it comes
Yeah.
to the.
So the address is Medicare at democratsabroad.org.
Medicare at democratsabroad.org. Awesome. So yeah, maybe we'll see more families reunified in a different direction than we think about family reunification when we hear that phrase in general. So now we're going to turn it over to Bruce, if you want to close up and offer some next steps to everyone before we finish our event today.
Thank you, Daniel, and thanks to all who have contributed to our vibrant discussion up front and behind the scenes. You all have given us plenty to push the envelope with healthcare improvements at home and abroad. Now it is up to us. And I think you know what that means. For those who have been feeling a midterm moody, we hope you're now eager to register to vote. Go to votefromabroad.org and let's get this show on the road. Plenty of us also likely are wondering which primary candidates deserve our support. Check out the DA event calendar for upcoming Meet the Candidates events like the one this Saturday for Pennsylvania governor and Senate candidates, and ask them about their healthcare plans. If you thought this was an okay event, get ready for our next one. Our global climate rally with special guests like Bill McKibben will propel us on the path to 1.5 or else, and in the process, also improve healthcare for all of us. By that time, we want to have met our amazing Double Your Donation Donor Challenge. The goal is to raise $2,500. When we do, we really will have raised $5,000, which goes a long way to finish our Build Back Better agenda, perhaps with some new faces on the Hill. By the way, we are getting close. Take a look and please consider helping us go over the top. Finally, go to the All Caucus page and sign up to volunteer. The time is now. Thank you, everyone. It's been an awesome event. Thank you all for participating. And as they used to say in the good old days, good night and good luck.